This is my informative speech from my summer 2012 speech class. Because I'm an RN, I chose to do my informative speech on sepsis because I feel it's very important for people to be knowledge in regards to this. What is the leading cause of death in America? Killing 258,000 Americans every year. Sepsis. One person dies every 2.5 minutes from sepsis. It's a medical emergency that requires prompt administration of antibiotics and fluids. Some objectives in this speech include what sepsis is, why early detection is important, some statistics in regards to it, and some general information on prevention and treatment options. What is sepsis? It's a condition in which the body is fighting a severe infection that is spread into the bloodstream. Patients that are diagnosed are often labeled as septic. If sepsis is progressed, it can cause someone to go into septic shock and even death. Some causes include different microbes such as bacteria or fungi, and some general infections that you may have that may later turn into sepsis include pneumonia, which is an infection of the lungs, urinary tract infection that includes kidney and the bladder, cellulitis, which is an infection of the skin, appendicitis, which is an abdominal infection in your appendix, and meningitis, which is a spinal infection, and many other physical infections or incision sites. Who is at risk of sepsis? Of course, the children and elderly. Children and elderly are usually at risk for any type of infection because they are slightly immunosuppressed. Anyone who is taking medications that may suppress the immune system, such as HIV patients, they're already immunosuppressed, but anyone taking any medications that may cause that. And what their immune system does is it works to fight infections, so they're more at risk for getting it. People who have their spleen removed, because your spleen helps your body to fight infection, even if that's another factor that may cause you to get it. People taking steroids, which is like we discussed earlier, people taking medications that suppress their immune system, or people with long-term diabetes, AIDS, or cirrhosis, which is a liver condition. Some signs and symptoms of sepsis include fever. They might have a normal body temperature, but they might start having chills or shaking because it's abnormal for their body temperature. They may generally run a little lower. So when they're running higher than normal, which could be in the norm, they typically chills or start shaking. Rapid pulse is another symptom. Rapid breathing, low blood pressure, confusion or disorientation. The person might not know where they're at or why they're there. That's another sign. Decrease in your urination or your output, and also peeing and all of your bones can be another. Statistics according to the National Surviving Sepsis Campaign, there are more than 760,000 cases of severe sepsis annually in North America, with 210,000 fatalities, making it the #1 cause of inpatient mortality. 1/3 of Americans have never even heard of sepsis. $24,500 was the average cost per person in 2001 for sepsis-related infections. In 2008, the proportion of hospitalized patients who were discharged to other short-stay hospitals or to long-term care institutions was higher for those with septicemia or sepsis at 36% than those with other conditions, which were at 14%. 17% of septicemia or sepsis hospitalizations ended in death, whereas only 2% of other hospitalizations did. Some ways you can prevent it. Well, in the outpatient setting, one key way to prevent it is getting recommended immunizations for both you and your child. By not obtaining any general infection, you're obviously preventing yourself from getting sepsis. And in the inpatient setting, one huge thing, which we talk about all the time, is hand washing and hand hygiene. Very, very important to wash your hands to prevent spreading any infections from patient to patient and decreasing the prevalence of this. Some treatment options, of course, if you are seeing any of these signs and symptoms or had any previous infections, seek medical attention right away. Once you do, you're generally started on antibiotics through IVs. You're also started on some saline fluids because you can become dehydrated from the pants or your body trying to overwork to get rid of the infection. and obviously you'll be hospitalized for the proper antibiotic treatment. In conclusion, sepsis kills at least 40% of the people infected with it. Its healthcare costs have increased to an estimated $14.6 billion in the United States in 2008. We need to make more people aware of sepsis, as it is the #1 killer in the health field. With prevention and early detection and treatment, we can decrease mortality rates. Thank you.